Hello friends. Happy UPSC to you. Here I am with series on Inside IAS Secure. It's compilation of GS Paper 2 from January to August. I have compiled all the keywords of Inside Secure together. It will help you revise Inside Secure. Please subscribe. I have brought a new series. Subscribe this YouTube channel. This IAS second part of January Inside Secure. GS Paper 2. Enjoy. Rural India has been witnessing slowdown, and one of the key factors contributing to it has been the fund crunch in the schemes addressing jobs in rural India. In such a scenario, discuss what Manrega can prove to be an effective solution. 250 words. Reference, Live Mint. Why this question? The article highlights the fact that with rural distress deepening across India and private consumption growing anemically, calls for ramping up the Mahatma Gandhi National Rural Employment Guarantee Scheme, regs, are growing louder ahead of the upcoming budget. Key demand of the question. Discuss in detail the importance of ramping up the Mahatma Gandhi National Rural Employment Guarantee Scheme, regs, as a cure to the rising rural distress in the country. Directive. Discuss. This is an all-encompassing directive. You have to debate on paper by going through the details of the issues concerned by examining each one of them. You have to give reasons for both for and against arguments. Structure of the answer. Introduction. Describe the current state of rural distress in the country. Body. Present. First, some data on key metrics such as wages, inflation, and consumption that indicate the present rural distress. Explain the crunch in funds related to other schemes that aim at improvising the rural economy. Explain the possible role that Manrega can play in fixing the issue. Take hints from the article and discuss what can be the way ahead. Subscribe this YouTube channel. Conclusion. Conclude with a balanced and fair opinion. Introduction. Body. Rural India has been witnessing slowdown. Mahatma Gandhi National Rural Employment Guarantee Act, Manrega. Crunch in funds related to other schemes that aim at improvising the rural economy. Subscribe this YouTube channel. Impact of Manrega. Challenges. Way forward. Subscribe this YouTube channel. Conclusion. Do you agree that the recent move to amend the MDP Act, 1971 is a progressive step towards empowerment of women as it looks beyond mere termination of pregnancy and aims to assure greater reproductive rights to women? Evaluate. 250 words. Reference, Indian Express. Why this question? Moving to ease abortion laws in the country, the Union Cabinet is set to consider a host of changes to the Medical Termination of Pregnancy, MDP, Act, 1971. Thus the question. Key demand of the question. Discuss in detail the impact of such a move taken by the government and explain in what way it shall ensure reproductive rights to women of the country. Directive. Evaluate. When you are asked to evaluate, you have to pass a sound judgment about the truth of the given statement in the question or the topic based on evidences. You have to appraise the worth of the statement in question. There is scope for forming a personal opinion here. Structure of the answer. Introduction. Start with a brief background. In recent years, there have been strong demands to raise the fetal gestation period for abortion beyond 20 weeks. Body. Discuss first the existing scenario. Comment on the changes suggested by the Union government. Explain the pros and cons of such a move. Discuss that the changes in law were proposed after an extensive consultation process with experts representing a range of stakeholders from central and state governments, NGOs, academic institutions, professional bodies, and associations like Indian Medical Association, Indian Nursing Council, and legal professionals. Conclusion. Conclude that the move to amend the MDP Act, 1971 is a progressive step towards empowerment of women. It will provide greater reproductive rights to women as abortion is considered an important aspect of the reproductive health of women. Deaths and injuries from unsafe abortions are largely preventable provided services are performed legally by trained practitioners. Introduction. Subscribe this YouTube channel. According to the Lancet Global Health Report, 15.6 million abortions occurred in 2015 in India, of which 78% were not conducted inside health facilities. Body. Abortion in India. Laws governing abortion in India. Changes suggested by the Union government to medical termination of pregnancy. MDP, Act, 1971. Only married woman or her husband. Significance of the changes. Subscribe this YouTube channel. Conclusion. The Supreme Court's decision to allow the introduction of African cheetahs into the Indian forests is a significant step forward in the conservation of the breed. Comment. 250 words. Reference, The Hindu. Why this question? The Supreme Court on Tuesday lifted its 7-year stay on a proposal to introduce African cheetahs from Namibia into the Indian habitat on an experimental basis. The plan was to revive the Indian cheetah population. Thus the question. Key demand of the question. Discuss in detail about the move by the court and arrangements made by it and in what way it is a significant step in conserving the species. Directive. Comment. Here we have to express our knowledge and understanding of the issue and form an overall opinion thereupon. Structure of the answer. Introduction. Describe briefly the background of the question. Body. There have been previous proposals to introduce African cheetahs in India, as part of a plan to revive the Indian cheetah population. The proposal was to introduce African cheetahs into the Palpur sanctuary in Madhya Pradesh on an experimental basis. However, the Supreme Court had stalled the plan in 2012. Explained that following a favorable view from the National Tiger Conservation Authority, NTCA, the Supreme Court has lifted its 7-year stay on a proposal to introduce African cheetahs from Namibia into the Indian habitat on an experimental basis. Discuss the significance of such a step. Explain concerns if any. Conclusion. Conclude with way ahead. Introduction. Subscribe this YouTube channel. Background. The initial plans were to bring the cheetahs to Gajiner Wildlife Sanctuary. Reasons for extinction of cheetahs. Population is vulnerable, trend with only less than 7,000 of them left in the wild globally. Man's interference. Wildlife. Conflict, loss of habitat and loss of prey, and illegal trafficking, have decimated their numbers. Significance of such a step. Conclusion. Subscribe this YouTube channel. Welfare schemes for vulnerable sections of the population by the center and states and the performance of these schemes, mechanisms, laws, institutions. and bodies constituted for the protection and betterment of these vulnerable sections. Discuss the objectives of National Tribal Youth Exchange Program. Why should the tribal pockets be mainstreamed? Explain, 250 words. News on air. Why this question? The 12th National Tribal Youth Exchange Program was inaugurated in Puducherry, under which tribal youths will be visiting many places to know about the language, customs, culture, arts, dressing patterns, food pattern, and other aspects of Puducherry. Thus the question. Key demand of the question. Discuss in detail the objectives of National Tribal Youth Exchange Program. And explain why the tribal pockets should be mainstreamed. Directive. Explain, clarify the topic by giving a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Structure of the answer. Introduction. Start by stating the facts like, Nehru Yuva Kendra Sangathan, NYKS, organizes tribal youth exchange program with the support of Ministry of Home Affairs, Government of India. Body. Discuss the objective of the program, to provide an opportunity to the tribal youth to understand the cultural ethos, language, lifestyles of the people depicting socio-economic and cultural development and development process unity and diversity aspect of our national life. Quote reasons as to why tribals should be mainstreamed. To deal with discrimination against tribal communities and in providing them with the rights they truly deserve. Discuss what steps the government is taking in this direction. Conclusion. Conclude that as India is aspiring to become a developed country, it needs to rethink and redefine its definition of development to incorporate the discourse of inclusive development. Introduction. Body. Aims and objectives of National Tribal Youth Exchange Program. Subscribe this YouTube channel. Need for tribal youth to be mainstreamed. Conclusion. Subscribe this YouTube channel. Subscribe this YouTube channel. Issues relating to development and management of social sector/services. Relating to health, education, human resources. The NITII's proposed 15-year plan for Indian healthcare entitled Health Systems. For a New India, Building Blocks Potential Pathways to Reform is a welcome move to improve the state of the healthcare system in India. Comment. 250 words. The Hindu. Why this question? The question is based on the set of NITII's proposed 15-year plan for the Indian healthcare system that was recently released. Key demand of the question. Discuss in what way the 15-year plan is a welcome move. Highlight the significance of such a roadmap and importance of achieving the final goals of it. Directive. Comment. Here we have to express our knowledge and understanding of the issue and form an overall opinion thereupon. Structure of the answer. Introduction. Bring out the highlights of the report. Body. Discuss the key findings and suggestions of the report such as, with regard to the risk pooling mechanism, even though the report has not outrightly suggested that Pradhan Mantri Jan Arogya Yojana, PMJ, the government's cashless health insurance scheme covering 10 crore poor families, 4 Rs 5 lakh annually, should be extended to the whole of India, it discreetly mentioned that PMJ should be considered with an eye on its potential to influence the overall healthcare transformation in India, beyond its current explicit mandate. The report is critical of the fragmented nature of the Indian healthcare system. It emphasizes the fact that overcoming the challenges of fragmentation across healthcare financing and service delivery will help India optimize both quality and access in the domain of healthcare services. It proposes the consolidation of small practices into larger business-like organizations. Discuss any concerns associated with the plan. Provide for counter-arguments if any. Conclusion. Conclude there is a need for installing an inbuilt family physician in the health services system who acts as the first port of call for every registered patient. Introduction. NITII's proposed 15-year plan for Indian healthcare, health systems for a new India, building blocks potential pathways to reform, elimination of informality, merging of fragmented risk pools, and reduction of out-of-pocket health spending. However, the proposal to consolidate small practices into larger business-like organizations appears problematic on multiple fronts. Body. Highlights of the report. Subscribe this YouTube channel. Challenges with the proposal. Importance of family physician. Increased commercialization of care. Measures needed. Subscribe this YouTube channel. Attitude, ethics, and communication, ECOM. Conclusion. A multi-sectorial and community-led approach driving a national movement is the need of the hour to end TB by 2025 in the country. Comment on the above statement. In the backdrop of India's still acclaimed to host highest TB burden in the world. 250 words. Indian Express. Why this question? The article discusses the need for a multilingual, multi-stakeholder awareness effort to ensure that every single Indian knows about the challenges of TB and where to seek treatment. Key demand of the question. Explain the scenario of TB hazard in the country and highlight the urgency and need to create a mass movement to end the menace of TB facing India. Directive. Comment. Here we have to express our knowledge and understanding of the issue and form an overall opinion thereupon. Structure of the answer. Introduction. Quote some key facts to highlight the impact of TB in the country. Body. India still has the highest TB burden in the world, and despite the disease being fully curable, people still die from it. Discuss what steps are required to be taken. How should the approach change from past to present? Scenario. Explain the significance of creation of awareness and empowering of communities. Conclusion. Conclude that as long as our people continue to die every year from this preventable and treatable disease, we are failing in our duties as citizens, doctors, administrators, and public health professionals. We must join hands to ensure a TB-free India. Each one of us can make a difference. Introduction. Global Tuberculosis, TB, report by WHO. Subscribe this YouTube channel. Body. TB situation in India. India's efforts to eliminate TB. Joint effort for elimination of tuberculosis, JEET. National Strategic Plan, NSP, for TB elimination, 2017 to 2025. Nikshay, Directly Observed Treatment Short Course, DOTS, Strategy. Challenges to achieve TB-free India by 2025. For socio-economic conditions. Subscribe this YouTube channel. Underreporting and misdiagnosis. Treatment. Follow-up treatment. Drugs. Funds. Issues with RNCTP. RND. Social stigma. Subscribe this YouTube channel. Way forward. Address the social conditions and factors. Increase political will, financial resources, and increasing research. Private sector engagement. The Kochi model, cost-effective point-of-care devices. Universal access to drug, susceptibility testing at diagnosis. Mass awareness campaigns. Conclusion. India, facing the double burden of malnutrition, has taken several steps to address it. And in spite of the progress made, there are still challenges facing India in the fight. Explain why and also suggest suitable steps that need to be assimilated in India's efforts. 250 words. The Hindu. Why this question? India, facing the double burden of both undernutrition and overnutrition, has taken several steps to address the same. The article discusses the need for more evidence-based policy making. Key demand of the question. Discuss the double burden in detail and explain the challenges in detail as to why the progress on this front is slow. Also suggest solutions to the problem. Directive. Explain, clarify the topic by giving a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Structure of the answer. Introduction. Subscribe this YouTube channel. Define malnutrition in general. Malnutrition, according to the World Health Organization, WHO, refers to deficiencies, excesses, or imbalances in a person's intake of energy and or nutrients. Body. The term malnutrition covers two broad groups of conditions. One is undernutrition, which includes stunting, low height for age, wasting, low weight for height, underweight, low weight for age, and micronutrient deficiencies or insufficiencies, a lack of important vitamins and minerals. The other is overweight, obesity, and diet-related non-communicable diseases, such as heart disease, stroke, diabetes, and cancer. Discuss the issue of malnutrition in India. Explain programs and policies in this direction. Conclusion. Conclude by suggesting way forward. Introduction. Body. Initiatives taken by government. ICTS. Universal Salt Iodization. Janni Suraksha Yojana, the National Rural Drinking Water Program, Matrit Vasahayad Yojana, Sabla for Adolescent Girls, Midday Meal Scheme, Targeted Public Distribution System, National Food Security Mission, MNREGA, and the National Rural Livelihoods Mission, National Nutrition Mission. Subscribe this YouTube channel. Poshan Abhayan PM's overarching scheme for holistic nourishment. Poshan Atlas. The Sustainable Development Goal, SDG-2 goal. Challenges still faced in fighting malnutrition. Mother's health. Social inequality. Sanitation. Subscribe this YouTube channel. Lack of diversified food. Lack of food security. Failure of government approaches. Disease spread. Poverty. Lack of nutrition. Subscribe this YouTube channel. Measures needed. As outrage continues over the deaths of newborns in parts of states like Rajasthan and Gujarat, the fact remains that India has the most child deaths in the world. Explain what happened in these regions and why does India have such a high child death rate? 250 words. Indian Express. Why this question? Every day, India witnesses the death of an estimated 2,350 babies aged less than 1 year. Among them, an average 172 are from Rajasthan and 98 from Gujarat. As outrage continues over the deaths, subscribe this YouTube channel. Of babies in J.K. Lawn Hospital in Kota, Rajasthan, and in the Civil Hospital in Rajkot, Gujarat, the fact remains that India has the most child deaths in the world. Thus the question. Key demand of the question. Discuss in detail the causative factors responsible for such a scenario. Explain what needs to be done to arrest the problem while suggesting way forward. Directive. Explain, clarify the topic by giving a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Structure of the answer. Introduction. Quote facts that suggest the context of the question. India has an annual birth cohort of approximately 26 million. The infant mortality rate, IMR, in the country currently stands at 33 per 1,000 live births. Body. First briefly provide a detailed spatial aspect of the IMR in the country across the states. Then discuss the reasons responsible, among the factors that have been proved detrimental to child survival are lack of education in the mother, malnutrition, more than half of Indian women are anemic, age of the mother at the time of birth, spacing, and whether the child is born at home or in a facility. The rates are lowest among children born to mothers between the ages of 20 to 24, remain low up to 25 to 34, and increase again after that age. According to the Health Ministry, the vaccination cover in India after several rounds of intensified Mission Indradhanush, MI, and the original MI, now stands at 87%. This means over 33 lakh children continue to miss out on some or all vaccinations every year. Discuss measures that are in place for sick newborns. Explain the efforts of the government in this direction. Conclusion. Conclude by suggesting way forward. Introduction. Body. Mortality rates in India. Factors for the high level of IMR. Subscribe this YouTube channel. Shortage of properly trained health workers and midwives. Mothers under age 20. Only 78.9% births in India happen in a facility. Enjoy. Rural India has been witnessing slowdown, and one of the key factors contributing to it has been the fund crunch in the backdrop of the recently released Pratham's Annual Status of Education Report. Deliberative India's learning crisis is linked to the weakness of the country's pre-primary education system. Present your opinion and explain the deficiencies in India's education system and how children have fallen short on basic learning skills. 250 words. The Hindu. Why this question? NGO Pratham's Annual Status of Education Report, ASER, in the past has spoken about deficiencies in India's education system and how children fall short on basic learning skills. In the latest edition of ASER, it directs attention to children between 4 and 8 years of age, and suggests that India's learning crisis could be linked to the weakness of the country's pre-primary system. Thus the question. Key demand of the question. Discuss in detail in what way if India's learning crisis is linked to the weakness of the country's pre-primary education system. Explain the deficiencies in India's education system and how children have fallen short on basic learning skills. Directive. Explain, clarify the topic by giving a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Structure of the answer. Introduction. In brief, highlight the conditions of Indian education system in general. Body. Subscribe this YouTube channel. Discuss the key statistics of the report, ASER. According to the Annual Status of Education Report, ASER, 2019, 21% children in grade 1 of government schools could read words compared to 46.7% in private schools, an advantage of 122%. Provide for reasons for such conditions, take hints from the article. Discuss the crucial role played by early childhood education, its lacunae in Indian education system. Suggest what needs to be done. Conclusion. Conclude with way forward. Introduction. Body. Findings of ASER Report 2019. Infrastructure deficit. Corruption and leakages. Quality of teachers. Subscribe this YouTube channel. Non-academic burden. The National Institute of Education Planning and Administration. NIPA. Teachers spend only around 19% of their time teaching. Poor salary. Firstly, the quality of teaching in schools drop, and secondly, the poor students are forced to spend money despite constitutional provision of free education. Teacher absenteeism. Lack of accountability. School management committees. High dropout rates. School closure. Teachers must only teach. Cluster administrators. Subscribe this YouTube channel. Teachers own collectives or networks build collaborations and institutional capacities. Digitization. Create a single window system for infrastructure and mainstream fund flows, audiovisual edutainment. Improve the quality as well as reduce the dropout rates. Biometric attendance for teachers and students for every class. Empower school management committees by using mobile phones. Facilitate school management committee. Fixing teachers' accountability, better pre-service teacher training. Coupled with transparent and merit-based recruitments, quality of teacher education, making teacher training mandatory. National Council for Teacher Education Act Amendment Bill, Diksha Portal. Increase the public spending on education to 6% of GDP, TSR Subramaniam. Committee. Administrative incentives, better pay, and a systematic change in the professional development. Conclusion. Subscribe this YouTube channel. Innovative. Digital interventions to improving the teacher and education quality along with proper governance. Structure, along with immunization, a comprehensive approach has to be designed for dengue cases for efficient and effective vector control management. Comment, 250 words. The Hindu. Why this question? The article discusses in detail the need for having a holistic approach to control and manage the vector-borne diseases such as dengue. Directive. Comment. Here we have to express our knowledge and understanding of the issue and form an overall opinion thereupon. Structure of the answer. Introduction. Discuss first what vector-borne diseases are and why are they so prevalent in the country. Body. Discuss with some key facts to highlight the urgency to change the current policy of handling the diseases. First, discuss why immunization alone can't suffice the requirement to eradicate the disease burden. And onset. Explain what should be a comprehensive strategy. Discuss from the article steps that need to be taken to prevent and better manage the cases of vector-borne diseases such as dengue. Briefly present the case of dengue in the country and justify. Conclusion. Conclude with way forward. Introduction. Body. Urgency to fight against vector-borne diseases. Subscribe this YouTube channel. Immunization alone is not sufficient. Integrated vector management, IVM. Dengue, effective vector management. Environmental management. Solid waste management. Street cleansing. AE. EDP, building structures. AE. EDP, QLEX. Quinquefasciatus, A. and Stefansi. Chemical management. Larvicide. Adulticide. Space spraying. Indoor residual spraying, IRS. Subscribe this YouTube channel. Biocontrol. Walbachia. Population replacement strategy. Conclusion. The Universal Immunization Program, UIP, of India has witnessed major breakthrough in the recent times. Elaborate on the progress made so far and discuss the way ahead. 250 words. Indian Express. Why this question? The government's comprehensive multi-year plan for 2018 to 22 details a comprehensive financial plan to fully immunize 26 million children and 30 million pregnant women with life-saving vaccines. Thus, the question. Key demand of the question. Discuss in detail the progress made on the immunization front by the country and in what way it has taken a major leap forward. Directive. Elaborate, give a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Discuss, this is an all-encompassing directive. You have to debate on paper by going through the details of the issues concerned by examining each one of them. You have to give reasons for both for and against arguments. Structure of the answer. Introduction. Start with what UIP is. Body. Comment on the aspects that prove Universal Immunization Program has contributed a lot in preventing so many diseases and deaths related to them. India. Explain that it is one of the largest in the world in terms of the number of beneficiaries, quantities of vaccine used, the geographical spread, the number of immunization sessions organized, and diversity of areas covered. Discuss what the vaccines under it are. Explain the impact of it, how it can collectively prevent at least 1 lakh deaths of adults in the working age group, 1 lakh infant deaths, and up to 10 lakh cases of hospitalization each year. Subscribe this YouTube channel. Till now, immunization has immensely helped bring down the annual mortality of children under 5. From 3.3 million a generation ago, to 1.3 million deaths in present, which is 17,000 deaths each day. Suggest way forward. Conclusion. Conclude that the improvements in immunization coverage and the introduction of a rotavirus vaccine will significantly alleviate disease and financial burden in Indian households. Population and regions with low existing immunization coverage benefit the most from the Universal Immunization Program. Introduction. Body. Progress of the scheme so far. Challenges. Subscribe this YouTube channel. Conclusion. For a sustainable universal healthcare model, maintaining a balanced trade-off between cost, quality, and access to healthcare services is critical. Discuss in the context of India's Ayushman Bharat and suggest the key takeaways that India can borrow from the famous Brazilian model of UPSC. 250 words. The Hindu. Why this question? The article discusses the lessons to be learned for India from Brazil's universal healthcare plan. Key demand of the question. The question seeks to ascertain the need for a balanced model for the concept of universal health care and what India can borrow from the famous Brazilian model. Directive. Discuss. This is an all-encompassing directive. You have to debate on paper by going through the details of the issues concerned by examining each one of them. You have to give reasons for both for and against arguments. Structure of the answer. Introduction. Briefly discuss the need for UPSC and its significance to the overall development of the country, and then explain the relevance of Brazilian model. Body. Explain that India's Ayushman Bharat can benefit by borrowing best practices from Brazil Universal Health Coverage Plan, such as public expenditure, community healthcare plan. Discuss India's Ayushman Bharat, highlight what India can borrow from the Brazil model. Explain the importance of maintaining a balanced trade-off between cost, quality, and access to healthcare services. Conclusion. Conclude that a collaborative approach aligning patients, payers, and providers, along with innovative partnerships, will hasten efforts to mitigate risks, drive impact, forge stronger social returns, and achieve sustainable UPSC targets. Introduction. Body. Subscribe this YouTube channel. Challenges in the healthcare value chain of India. Unified Health System, SUS, of Brazil. Lessons for Ayushman Bharat from UHS of Brazil. Subscribe this YouTube channel. It was able to reach even the rural areas and the poorest states of the country. Way forward. Discuss the interrelationship between an outbreak of a disease and economy of a country while analyzing the case of recent outbreak of coronavirus. 250 words. Reference, Indian Express. Why this question? The outbreak of a new virus in China has sent shivers through world financial markets, with investors drawing comparisons to the 2003 SARS, severe acute respiratory syndrome, outbreak in order to assess its potential economic impact. Thus the question. Subscribe this YouTube channel. Key demand of the question. Discuss in detail the impact of an outbreak of a disease upon the economy of the sufferer country in general and more specifically explain how it can lead to a sudden slump in the economy. Directive. Discuss. This is an all-encompassing directive. You have to debate on paper by going through the details of the issues concerned by examining each one of them. You have to give reasons for both for and against arguments. Structure of the answer. Introduction. Start by mentioning the recent outbreak of coronavirus in China. Body. Start with fact. A 2017 paper by economists Victoria Fan, Dean Jameson, and Lawrence Summers estimated that the expected annual losses from pandemic risk to be about $500 billion or 0.6% of global income per year, accounting for both lost income and the intrinsic cost of elevated mortality. A paper by John Wally and Warwick McKibben estimates the global economic loss due at SARS at $40 billion in 2003. However, price action in markets indicates that the impacts of such outbreaks are limited. After Chinese authorities reported the outbreak of SARS to the World Health Organization, who, in 2003, the MSCI China index of shares decoupled from its global peers, but made up the lost ground in only 6 months. Explain that there are both winners and losers. Despite the disruption to the wider economy, virus outbreaks have tended to benefit pharmaceutical stocks, while tourism and travel-related stocks, hotels, airlines, and luxury and consumer goods tend to get punished. Discuss the case of China and coronavirus outbreak. Conclusion. Conclude with what should be the way forward. Introduction. Body. Interrelationship between an outbreak of a disease and economy of a country. Subscribe this YouTube channel. Positive impacts. Negative impacts. Impact on Indian economy. Way forward. Subscribe this YouTube channel. Conclusion. What do multiple outbreaks of polio in the vicinity mean for India? Should India worry? Discuss the achievements made by polio immunization program so far and what should be the way forward. 250 words. Reference, Indian Express. Why this question? The article highlights the polio comeback in a number of countries and the repercussions it can possibly have on India. Key demand of the question. Discuss in detail the achievements made by polio immunization program so far, explain how onset of polio in neighborhood can be worrisome to India and what should India do to overcome it. Directive. Discuss. This is an all-encompassing directive. You have to debate on paper by going through the details of the issues concerned by examining each one of them. You have to give reasons for both for and against arguments. Structure of the answer. Introduction. Describe the current situation of onset of polio in several countries. Subscribe this YouTube channel. Body. Explain that in the last 1 year or so, polio has made a comeback in countries such as the Philippines, Malaysia, Ghana, Myanmar, China, Cameroon, Indonesia, and Iran, mostly as vaccine-derived polio infection, and that all these countries had wiped the virus out at various times during the last couple of decades. Some, such as Iran and Malaysia, had done so even earlier. Explain. Should India worry? Discuss the achievements made by the polio immunization program of the country. Explain where does India stand? What precautions should India take and the lessons it should learn to overcome the possible threat of onset. Conclusion. Conclude with way forward. Introduction. Body. Current situation of onset of polio in several countries. Subscribe this YouTube channel. What do multiple outbreaks in the vicinity mean for India? Steps taken by the government to maintain polio-free status in India. Quality national and sub-national polio rounds. Each year. Rapid Response Team, RRT. Emergency Preparedness and Response Plan. EPRP, Continuous Vaccination Teams, CVT. To respond to detection/importation of wild polio virus, WPV, National Technical Advisory Group on Immunization. NTGI, conclusion. Subscribe this YouTube channel. Important aspects of governance, transparency, and accountability, e-governance applications, models, successes, limitations, and potential, citizens. Charters, transparency and accountability and institutional and other measures. Good Governance Index, GGI, is a welcome exercise to incentivize states to competitively deliver on public services to the citizens. Elucidate, 250 words. The Hindu. Why this question? The article discusses in what way marking states on different parameters can incentivize performance. Key demand of the question. Discuss in detail the importance of Good Governance Index, GGI, and in what way it aids the different states to competitively deliver on public services. Directive. Elucidate, give a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Structure of the answer. Introduction. Discuss first the importance of governance in general. Body. First explain what is Good Governance Index, GGI. It is a tool to assess the status of governance and the impact of various interventions taken up by the state government and UTS. Discuss the objectives of GGI. Highlight the key findings of the GGI report. Explain how it can help building a competitive spirit amongst different states of the country and aid in overall growth and development. Conclusion. Conclude with way forward. Introduction. Body. The objectives of GGI are key findings of the GGI. Subscribe this YouTube channel. Importance of GGI. Conclusion. Subscribe this YouTube channel. In the recent hearing of Tripura High Court that ruled, posting on social media was tantamount to a fundamental right applicable to all citizens, including government employees, provides a moment of opportunities and obstacles to the government servants. Do you agree? Critically examine the statement, 250 words. The Hindu. Why this question? In a landmark order, the High Court of Tripura ordered the police to refrain from prosecuting a man who was earlier arrested over a social media post. The Chief Justice in his order broadly remarked that posting on social media was tantamount to a fundamental right applicable to all citizens, including government employees. Key demand of the question. One must provide for a detailed analysis of the judgment that was passed recently in this regard. Directive. Critically examine. When asked to examine, we have to look into the topic, content, words, in detail, inspect it, investigate it, and establish the key facts and issues related to the topic in question. While doing so, we should explain why these facts and issues are important and their implications. When critically is suffixed or prefixed to a directive, one needs to look at the good and bad of the topic and give a fair judgment. Structure of the answer. Introduction. Briefly highlight the observations made in the order. Body. Discuss the aspects such followed. Explain first the importance of fundamental rights to citizens, public servants, etc. Elaborate as to why it is important to civil servants. Discuss the significance of fundamental rights with respect to the case of social media. Conclusion. Conclude with way forward. Introduction. Body. Social media and rights of citizens. Supreme Court, subscribe this YouTube channel. In the Tripura case. Civil servants' rights and social media. Arguments in favor. Outreach. Mumbai traffic police. Real-time engagement. Managing perceptions. Swak Bharat Abhiyan, voter awareness, etc. Checks and balances are needed. Subscribe this YouTube channel. Conduct rules should also be applicable. Exercise restraint, Article 33. Armed forces. Paramilitary forces, police, and intelligence agencies, discipline. Conclusion. With data being the new oil, National Data and Analytics Platform will work to democratize access to publicly available government data. Elucidate. 250 words. Reference, Economic Times. Why this question? NITII released its vision for the National Data and Analytics Platform, NDAP, recently, thus the question. Key demand of the question. Discuss in detail the significance of such a platform in aiding to democratize access to publicly available government data. Directive. Elucidate, give a detailed account as to how and why it occurred, or what is the particular context. You must be defining key terms wherever appropriate, and substantiate with relevant associated facts. Structure of the answer. Introduction. Start with the concerns that we're raising about access of available government data. Body. Comment on the features of the National Data and Analytics Platform, NDAP. It aims to democratize access to publicly available government data. It will host the latest datasets from various government websites, present them coherently, and provide tools for analytics and visualization. It will follow a user-centric approach and will enable data access in a simple and intuitive portal, tailored to the needs of a variety of stakeholders. It will spearhead the standardization of formats in which data is presented across sectors. It would cater to a wide audience of policymakers, researchers, innovators, data scientists, journalists, and citizens. Discuss the advantages of the move, explain any concerns associated. Conclusion. Conclude that the platform will bring in more transparency and accountability and will help in achieving the vision of Digital India under one of its pillars, information for all. Introduction, subscribe this YouTube channel. Body. Concerns that we're raising about access of available government data. India has rich publicly available data. Data is not published in a user-centric manner. Data ecosystem is incoherent due to different standards. Features of the National Data and Analytics Platform, NDAP. The advantages of National Data and Analytics Platform, NDAP. Conclusion. Subscribe this YouTube channel. India and its neighborhood relations. India's unsettled boundaries pose major problems in its policy towards its neighbors.